Yes. Taking non-political cases. What homeopathy is America.
Hello. Yes, good morning, sir. I can hear you. No, I cannot hear you now.
Yes.
The voice is breaking, sir.
My now,
Voice is breaking, sir.
That's it. This is cooperation. This is a today. And she is
Good morning, sir.
You can start, madam.
Okay, can I start?
Yes, you can start, madam.
Okay, okay. Am I audible and visible clearly?
Yes, madam. You can start.
Yes. Okay, so very good morning to everyone. And first of all, thanks a lot to Dr. Manilales. Thank you so much for the opportunity, sir. And also, Principal Sir, Dr. P. Venkatesh Rao. Thank you so much for the opportunity. So, and also a special thanks to Dr. Sneha for believing in me and for the opportunity. So, thank you so much again. Now, let me begin my presentation with the. I hope my screen is visible. So, the presentation is regarding the role of homeopathy in different gynecological cases. Along with a right diet, lifestyle, and a holistic support, we can help a lot of women with a lot of gynecological problems. So, before we deal with the gynecological cases, I dig into them. Let me just explain that women have basically three phases in life. You can divide them in three phases roughly. That is the puberty from 11 years to 16 years roughly. Then the reproductive age from the 17 to the 40 years, or you can also divide it into the perimenopausal age. But basically, they are just the three phases mainly. And lastly is the menopausal. After 40, 45, you can say the menopausal stage. Now, what are the common gynecological disorders in which where we as homeopaths can specially provide support? So I have divided them according to the categories. So firstly is the puberty, where we see precocious puberty, delayed puberty, menstrual irregularities, and leukorrhea, etc. Then in the reproductive age, we can again divide it into two parts, that is the gynecological disorders and the obstetric disorders. So in gynecological disorders, there are menstrual irregularities again, leukorrhea, PCOD, PCOS, which is very common nowadays. Then infertility, endometriosis, adenomyosis, fibroids, polyps, DUB, anemia, and fatigue. Right. Then in obstetric disorders, again, we can have a lot of disorders where we can provide support with right constitutional remedy with homeopathy. So these are hyperemesis gravidarum, gestational hypertension, gestational diabetes, gestational thyroid, GI disorders during pregnancy, UTIs during pregnancy, hemorrhoids, which aggravate especially during the pregnancy period, then habitual abortions, abnormal presentations where there is breech presentation, then postnatal depressions, etc. So a lot of problems are there during pregnancy where we can provide support with right homeopathic treatment. Then of course menopause, the menopausal ailments, hot flushes, etc. we can provide relief with a wide range of medicines that we have. Now, these common gynecological disorders that we discussed just now, I'm going to deal with the four main ones in detail. Okay, so in puberty, the first two are the precocious puberty and the delayed puberty. So we are going to deal with them one by one. So the first is precocious puberty. Now, what is precocious puberty? What is puberty? First of all, puberty is when the reproduction starts, when the female begins to menstruate, the menarche sets in. Now when this menarche sets in at a very early age, then it is known as early puberty or precocious puberty. Okay, so in homeopathy we have a lot of rubrics which can help us find out the right remedy, because this thing has already propped in and it has become very common these days. Very young girls, they've started to menstruate. 10 years, even 9 years, 8 years, they come up with these kinds of ailments or menses. So there is a rubric, female menses appears proper age before the. So you can see 30 remedies are described. Some of them I have highlighted, which are frequently used ones. So Antim crude is there, Calcarea phos. You can easily make out these children because they tend to be a little obese and overweight, chubby kind of children. So Calcarea cards are easy to detect. Antim crude is also that kind of a obese child. Then you have Casticum, Camomilla. Camomilla is easily recognized through her mental symptoms. They are a little aggressive kind of, they get angry very soon, that kind of irritable children. Okay. So there are a whole lot of remedies you can go through, and according to the constitution and temperament of the child, you can prescribe the medicines. Then again, there is a rubric, female puberty before, then female menarche, first menses appears before the proper age. Again, 29 remedies are mentioned. Now, there is a rubric, female puberty before. How do you categorize this? So puberty in females, puberty comprises of three main, you can say, landmarks. That is the thelarch, adrenarch, and the menarche. Now, even before the thelarch, if menses appears, that means puberty has not set in properly and menses has begun. So then you can go for these four remedies. That is Calcarea, Senna, Sabina, and Silesia. Now, I have listed down some of the important remedies and their indications for precocious puberty. So these are antim crude, Calcarea carb, Calcarea phos, Casticum, China, Cinna, Caliphos, Phosphorus, Sabina, Silesia, and sulfur. So, as I said, obese, flabby, and chilly children, you can think of Calcarea, Kali carb, and antim crude. For thin, tall, and growing children who are growing very fast, you can think of Calcarea phos, Phosphorus, and Silesia. Then, where there is sexual irritability or early genital handling, you can think of Cinna, sulfur, and phosphorus. With early profuse bleeding, there is Sabina, Calcarea carb, and phosphorus. Then weak, debilitated after early puberty, there is China and Silesia. So this is a list where it can help us to select the right remedy for the child. Now we come to the delayed puberty. This is just the opposite of the precocious puberty, where the puberty or the menses have not set in as long as 16 years or 17 years. Okay. So if there is no structural abnormality, no congenital problem, then if there is a delayed puberty, then it might be because of the hormones, because of the endocrinal issues. So we can support it with homeopathy through these rubrics. We can go through them. The first is delayed puberty in girls. We have 52 remedies listed, and I have highlighted some of the frequently used medicines for you. So the bold ones are the Aristolochia clematitis, Casticum, Graphitis, Calicarb, Natrimur, Pulsatilla, and Senecio. These are the bold ones. And we also have Calcarea, Calcarea phos, again antim crude, Ferrum. So there are a lot of medicines which are overlapping in the precocious as well as in the delayed puberty. So this is basically because of the hormonal imbalance. Okay. Now again, I have listed them according to the constitutions or the prominent symptoms. So the frequently used medicines I have listed, and in case of stunted growth and childishness, of course, Beraita carb is a great remedy for the patient is a very childish behavior she has. So you can think of Beraita carb. Again, Calcarea carb is there, also present in the stunted growth, where they don't grow much in terms of height, you can say. And Graphitis. Then thin, tall, rapidly growing, and emaciated. You can think of Calcarea phos, Natrimute, Tuberculinum, and zinc. In case of anemic, Ferrum phos, Pulsatilla, and Caliphos. These remedies play a very, very important role. Then in case of nervous weakness, Sepia, Casticum, zinc, and Caliphos. They are very, very important remedies when there is nervous weakness especially involved. Then where emotional and mental causes supervene, we can think of Natrimur for grief, Pulsatilla for girls who are very timid in nature, and Aurum where they have depression or even suicidal tendencies. Now we come on to the third category, that is the menstrual abnormalities. Now I have listed these menstrual abnormalities into 8 categories. So these are 8 common menstrual irregularities or abnormalities that we tend to see in clinics. The first is amenorrhea, that is the absent period. And from amenorrhea here, we mean the secondary amenorrhea. That means menses have set in, and after setting in, it has stopped. So this we consider as secondary amenorrhea. Then there is dysmenorrhea, which means they are painful periods causing cramps, nausea, backache, etc. And with dysmenorrhea, we especially mean painful periods where the day-to-day activity is affected. With periods, we tend to have some of pain and discomfort will be there. Okay. But when the pain is so much severe that your daily activities are affected, then it is considered as dysmenorrhea. Then oligomenorrhea is infrequent cycles. That means the duration or the time period of the cycle is greater than 35 days. Means the menses are coming after 35 or more days. That is oligomenorrhea. Then polymenorrhea is frequent periods. That means menses are coming in less than 21 days. The frequency of the periods is more. That is polymenorrhea. Then hypomenorrhea is scanty periods. Your periods might come on time, they might be a little delayed or early, but the important is that they are scanty periods. That means they will last only for one day or for few hours. That is hypomenorrhea. Okay, and the quantity will be very, very less. Then the sixth is menorrhagia or hypermenorrhea, where there is excessive bleeding. Excessive bleeding for more than 6 days, 7 days, continuously the bleeding is occurring and occurring. That is menorrhagia. Then metrorrhagia. Metrorrhagia is bleeding between the periods. Periods have come, the bleeding happened and it stopped. Then again in between the periods, some kind of bleeding is happening. That is metrorrhagia. Then premenstrual symptoms. Premenstrual symptoms are that just before your periods, there are a lot of symptoms coming up or aggravating. That is bloating, there is extreme indigestion, flatulence, breast tenderness, heaviness, acne are coming up, tiredness is there, fatigue. All these are come under a premenstrual syndrome. And after menses or just when the menses have set in, all these symptoms subside automatically. Now we will deal with them one by one. So amenorrhea, as I have said, we consider amenorrhea as the secondary amenorrhea. That is the true amenorrhea, which is primary and secondary. Primary is where menses have not set in at all. Okay, the menses have not started. That is primary amenorrhea. And where the menses have set in and then it has stopped, that is the secondary amenorrhea. Now, what are the causes of primary and secondary amenorrhea? In case of primary amenorrhea, usually we see that there is hypothalamo-pituitary ovarian axis, which is causing the problems. So there might be hypogonadotropic hypogonadism, hypergonadotropic hypogonadism. Okay, we will have to differentiate between these things. Sometimes delayed puberty and this primary amenorrhea is also very thin line between them. So this is the judgment of the physician, that we have to judge whether it is a delayed, this is a case of a delayed puberty or a primary amenorrhea. So after all the investigations proper have been done, then we have to conclude that this is a case of primary amenorrhea. And usually we don't get to see these cases in clinic. I have never seen a case of primary amenorrhea. We only see cases of secondary amenorrhea usually in our clinics. Now, in case of secondary amenorrhea, it is absence of menstruation for 6 months or more after normal menses have already established. So what are the main causes of this secondary amenorrhea? There are uterine factors, there are ovarian factors, there are pituitary factors, there are hypothalamic factors, there are adrenal factors, there are thyroid factors. Then there can be some systemic illnesses and some iatrogenic factors. So we see that the whole hormonal orchestra, it works to establish a normal menstrual cycle. And if one hormone is disturbed, it tends to disturb the other hormonal orchestra as well. So any of those hormones can be a triggering factor, and then the menses stops. Now next, if we go through the repertory, we see a lot of rubrics for amenorrhea. The first is female amenorrhea, menses absent. So in case of especially primary amenorrhea, you can go with this rubric where the menses have not set in at all. This is amenorrhea, menses absent. In young girls, you can see there is a rubric, only two medicines are mentioned. One is Ignatia and the other is X-ray. Okay, but I haven't seen any case of primary amenorrhea till now. Then in case of secondary amenorrhea, we can go with the rubric female menses suppressed. That means menses had established, but now it got suppressed due to various reasons. Now, when especially in young girls it is seen, there are 4 medicines listed: Calcarea phos, natramur, podophyllum, and pulsatilla. I have highlighted this rubric. And in case of young girls, there is another rubric where only single medicine senecio is present. Okay, then according to the constitution also you can take the sub-rubrics, like feeble women, you can think of sepia; plethoric women, that is veratrum veride given in bold. Also belladonna is present, glonine is present, and some other remedies. Then scrawny women, there is a single remedy, Sickle core. These are very thin, scrawny, no muscles at all, no fats at all, very thin women. That is scrawny women. Then scrofulous women are Beretta car, Silesia, and sulfur in second grade given. In thin women, you see again Apis, Argentum nitricum, Nux vomica, Phosphorus, and Sickle core. So these are some rubrics which will help you in selecting your right remedy or the simillimum. Then again, there is a rubric. Sometimes patients come and they say that I think menses are about to appear, but they are not appearing. They have a feeling that it is about to come, but it doesn't come. So you can go with the rubric female menses appear as if would. So 51 remedies are given here. And according to the symptoms, you can select your remedy. Now, again, I have listed some important medicines here. For delayed puberty and sluggish girls, we can think of Calcarea car, Calcarea phos, Graphitis, Silesia, and Lycopodium. Anemia and chlorosis, you can think of Ferrum, Calcarea phos, and Natramine. For emotional causes, you can think of Ignatia, Lachesis, Natramur, Nux mosqueta, and Pulsatilla. Nux mosqueta is also a very, very important remedy for amenorrhea in females, especially when the emotional causes are present. And these women are very, very thirstless. The important symptom is that they are thirstless and they will be very, very fatigued or sleepy all the time. They will not be very active, or you won't see them in a very energetic distinct condition. They tend to be very, very weak or have a low energy, and they sleep a lot. So you can think of Nux mosqueta. Then in case of venous stasis and bearing down, sepia and sulfur. Then when regulatory remedies fail, when you think that your indicated remedy, your apparently indicated remedy has failed, then you can think of Senecia, Aristolochia, Clematitis, and X-ray. X-ray is a remedy where it stimulates the vital force so that the other indicated remedies also start to work well. So sometimes X-ray can trigger that or give that stimulation in your patient. Now we come to the third menstrual abnormality, that is the dysmenorrhea. Dysmenorrhea is again of 2 major types, that is primary and secondary. Primary is the spasmodic dysmenorrhea, where there is no identifiable pelvic pathology. And the secondary is the congestive dysmenorrhea, where menstruation is associated with pain occurring in presence of pelvic pathology. Now, the secondary or congestive dysmenorrhea is usually what we tend to see, because the primary ones, they don't come to us for homeopathy. They tend to take allopathic remedies, and they think homeopathy will act slow and they don't want to bear pains. So usually girls have a habit of taking Meftal spas, etc., for this primary amenorrhea. So usually you don't see cases of dysmenorrhea that prominently. They come to us when they have developed some pathology like endometriosis or adenomyosis, etc., where there is extreme pain. They're taking medicines and it's not working, and every month they have the same problem. So these are the cases of secondary or congestive amenorrhea. And the important symptom of congestive dysmenorrhea is that their pain is relieved as the menses proceeds. One day, second day, third day, the pain tends to go down. But in case of primary or spasmodic dysmenorrhea, more the menses, more the pain. More the flow, more the pain. So semicifuga kind of symptoms are seen in case of primary dysmenorrhea. Then we have two more categories. One is membranous dysmenorrhea and the other is the ovarian dysmenorrhea. In case of membranous dysmenorrhea, it is a variant of primary only, but it is very rare. And big endometrial casts are shed in this. Okay. And in ovarian dysmenorrhea, pain is 2-3 days before menses, just like in congestive dysmenorrhea, and pain is dull and continuous, and it is due to ovarian nerve degeneration or sclerosistic condition of the ovaries. So this is ovarian in origin, that is the ovarian dysmenorrhea. Now, if we have a look at the rubrics present in the repertory, I use Murphy's repertory, 3rd edition. So these are some screenshots of the radar software that I have taken, and I have highlighted some of the important rubrics and the medicines. So here we see, in case of primary or spasmodic dysmenorrhea, female pain, uterus, menses during. Right? This is a rubric with 52 remedies. Then there is a sub-rubric, beginning of at. Again, 11 remedies are present here. So according to your case, you can think of the remedies. Then there is a rubric, cry out compels her to during. Again, 11 remedies are mentioned here. Now, in case of secondary or congestive dysmenorrhea, you can think of female pain, uterus, amelioration during. That means when the menses have set in, the pain tends to ameliorate. So you can think of these many remedies. Then again, membranous dysmenorrhea, there is a separate rubric for membranous dysmenorrhea with 42 remedies. And in case of ovarian dysmenorrhea, you can think of female pain, ovaries, menses aggravation during. This is the rubric that I have selected, and this is 27 remedies mentioned. So you can see the important ovarian remedies like Epis, Palladium, Lachesis, Thuja. These come under the ovarian neuralgia or ovarian dysmenorrhea. Now, the homeopathic support. Again, I have listed some of the important remedies. So this is for primary or spasmodic dysmenorrhea. We have, if better by warmth, pressure, and bending double, we have 3 remedies, that is Magphos, Colocynth, and Chamomilla. Constriction, band-like pain, Cactus. Cactus is a remedy for heart symptoms, but it is also a remedy for primary dysmenorrhea. Then labor-like pains radiating to thighs. Semicifuga is an important remedy. Just like I said before, that more the flow, more the pain. So semicifuga is present in labor-like pains also radiating to thighs. and viburnum. Viburnum is also a very, very important remedy for all kinds of pains during menses. Then in case of neuralgic radiating pain, xanthosylum and cocculus. For emotional and mild individuals, pulsatilla. Irritable and frantic, chamomilla and nux vomica. Tubercular constitutions, there is tuberculinum. So these are some important remedies for primary dysmenorrhea. For secondary, puberty, thin, tall girls and delayed calcarea phos. Estrogenic congestion and ovarian cysts, we have to think of folliculinum. And usually these days, where there is so much hormonal imbalance, folliculinum is a very, very important remedy. And it is a must to have in all gynecological practices. Then venous congestion, hot, left ovary, better flow begins, there is lachesis. Bearing down, venous stasis, and indifferent. Important remedy is sepia. If pre-flow suppression and congestive pains are present, then viburnum is the remedy. Then congestion plus restless nerves, that is fidgety feet, you can think of zinc. So some medicines have prominent symptoms and it is very easy to recognize them. But sometimes it is very, very difficult to find out remedies because patient, they don't want to wait. So usually these patients come to us with chronic conditions where they have already suffered a lot and where they have already taken a lot of painkillers, etc. And still they find no relief. So then they come to us. So now we come to oligomenorrhea. Oligomenorrhea, as I said before, that the menses is very, very late. That means the cycle is more than 35 days. So according to the number of days it is delayed, we also have rubrics. You can see so many sub-rubrics are present: 2 days too late, 2 or 3 months, 3 days too late, 4 days too late. So we have a whole list of sub-rubrics like that. And so many remedies for, in general, late menses. That is 190 medicines are given. Now I have highlighted some of the rubrics. In case of young girls, there is a rubric with 4 remedies. And in case of puberty also there is a sub-rubric with 12 remedies. Now this oligomenorrhea can be scanty also and it can be profuse also. The menses come after 35 days. They might be delayed 10 days or 12 days, but when they come, they are very profuse. Okay, so you can go for the sub-rubric female menses late to profuse